Okay, this is chapter 30C from the Medical Reformation. We're talking about causes of dementia, just kind of going into some of the details. And this is, a little bit maybe the boring part of the book where I go through some of the details without having all the pictures. The parts of the book, which is most of it, where there's a lot of pictures, are probably more fun for most people. But just some extra information like on Parkinson's disease. Most common cause of Parkinson is destruction of the dopamine-producing neurons in the substantia nigra of the midbrain. Substantia nigra just means substance black, the black stuff in the anterior part of the midbrain. Midbrain is where you'd expect in the middle of the brain. The brain only has about 400,000 total dopamine neurons, and each one is precious. Usually a person's lost about 70% of their dopamine receptors, neurons, before they're diagnosable with Parkinson's. Some of the risk factors, like any disease, it's genetic, it's associated with aging, but it's also increased in persons exposed to pesticides, like mitochondrial pesticides. And like I said, I've recently, given a lecture on over 50 types of common mitochondrial inhibitors. So if you have Parkinson's or you're thought to be high risk for it, you would want to avoid all those mitochondrial inhibitors. That's an example of intelligent things you can do to reduce your risk of symptomatic disease. If you look at an internet search of global distribution of Parkinson's, you'll see it kind of matches a typical pattern of autoimmune diseases, a typical pattern of Western diseases. The farther one gets from the equator, the more you have atherosclerosis, obesity, diabetes, and autoimmune disease. And, what happens farther you go from the equator? People eat more meat and dairy. People get less sunshine. They get less vitamin D. They eat less plant foods. Meat eaters have more Parkinson's disease. A high-protein diet is a competitive inhibitor of tyrosine entry into the brain and L-DOPA. You're also more prone to having leaky gut when you're eating that type of a diet because a meat and dairy diet, there's no fiber in meat and dairy. So you can get leaky gut and get all that autoantibody cross-reactivity stuff. What about iron? Iron overload worsens Parkinson's. Most Westerners, men after about 20 or so years of age, start becoming iron overloaded. Most women start becoming iron overloaded after menopause in the Western world because so many foods are fortified with iron, plus the meat tends to have high iron, like red meat especially. Let's see, what else? What about diabetes and Parkinson's? Yeah, the more diabetes you have, it increases the risk of Parkinson's. Substantia nigra neurons in the midbrain have glucose type 4 transporters, meaning that they are vulnerable to dysfunction in the setting of insulin resistance. The main cause of insulin resistance is high-fat diets. Okay, that's known. By the way, some people will dispute that on some of my shorts and stuff, but basically that's been known for a long time. The J. Shirley Sweeney study was back in 1927 where he fed medical students high-fat diets and then they would fail their oral glucose tolerance test, become like insulin resistant, versus if you fed them low-fat diets, they did not. And that's been reproven through numerous studies. Okay, what about alpha-synuclein in Parkinson's? Parkinson's is associated with abnormal folding of an alpha-synuclein protein, and there's other synucleinopathies, diseases associated with problems with synuclein, and that includes Lewy body dementia, multisystem atrophy. Proteins need to be folded correctly in order for them to be functional. Okay, the problems with folding proteins is an issue of what's called proteostasis, ability to keep proteins as they should be. Increased amounts of oxidative stress, as can occur with excessive iron overload, can lead to misfolding of proteins. There's a lot of overlap between Parkinson's and Alzheimer's. When they look at the autopsies of the brains, there's often many features of both, even though the autopsy diagnosis of Alzheimer's is not anywhere near what people pretend that it is. And you'll see features of so-called Alzheimer's and so-called Parkinson's overlapping. That's what I mean by a lot of these diseases. They're not as well diagnosed as you think. And the autopsy diagnosis of Parkinson's also is nowhere near as good as people think it is. Okay, and like I said too, when you start getting into all this stuff talking about autopsy diagnosis, that's really not as helpful. What really matters for a person who might have these diseases or be thought to be high risk is what can they do to reduce the risk of the disease or to decrease their symptoms. And so for starters, avoid things that are toxic to the brain. Avoid chemicals that smell bad. Avoid chemicals that have other reasons for you to think they're toxic. Avoid eating or drinking bad chemicals. All these estrogenic chemicals, oils, they tend to cause lipid peroxidation. Toxic aldehydes like hydroxynonenal. That's the whole Yamashima, the Japanese neuroscientist, theory of neurodegeneration from omega-6 cooking oils. He feels that's a big reason why Japan has markedly increased rates of dementia compared to the past, because they're eating more cooking oils. Let's see, you could avoid, the saturated fat from primarily animal foods. You could avoid the iron overload from, iron fortified foods and from the meats. Meats also sometimes contain accumulated organophosphate pesticides because the animals eat higher up the food chain, if you will, and they concentrate the herbicides and pesticides sprayed on the plant foods. Anything that can cause leaky gut can increase the risk of Parkinson's. There's a whole set of theories claiming that some people think Parkinson's might have its causation related to problems with the gut, because they're often constipated as one of the earliest symptoms. Okay. And that's the so-called, vagal nerve Brock hypothesis stuff. So persons who've had a vagotomy where they've cut the vagus nerve for other reasons, like let's say for stomach ulcers, have a lower incidence of Parkinson's disease. And Brock was a pathologist who showed Lewy bodies were found in the gut enteric nervous system, the nervous system around the gut, as well as the vagus nerve in the brainstem. And he claimed that, talked about them being constipated for years before they develop other symptoms like a tremor. And he felt that, in Brock's opinion, he thought it tended to originate in the gut and progress towards the substantia nigra. It's not that simple. There are other researchers, though, and I think some of this work was done at Johns Hopkins, where they injected alpha-synuclein into the gut wall of rodents, and this was associated with increased incidence of Parkinson's, and they wondered if it was partially causative. They wondered if this is some type of prion mechanism whereby a protein precipitates, enlarges, comes out of aqueous solution, pushes on other similar proteins, and causes a domino effect to cascade towards the central nervous system. Okay, so what's the point of mentioning all that stuff? Well, the smart move would be avoid things that cause leaky gut. Make your gut happy, which means eat a lot more plant foods, a lot more fiber. Plus, obviously, avoid the other things associated. For any disease, that's what you want to know. You want to know what causes the disease, because quite often, very often, if you avoid the thing that causes the disease, you also improve. And let's say you already have the disease. Well, then you decrease the likelihood the disease is going to progress, because quite often what causes it in the first place keeps on making it progress. And if you can stop that, you got a much better chance to prevent progression or maybe even cure the disease. Okay, yeah, and most patients, like I a lot of times will have to biopsy patients, and patients get all freaked out about possible cancer. We're usually doing a biopsy to rule out cancer, but cancer is not like the main thing to be afraid of for dying. The main thing that pushes people towards dying is all this obesity, diabetes, and hypertension, because those are like the main risk factors to push you towards developing atherosclerosis. And then atherosclerosis, plugging up an artery in the heart, it's a heart attack. Plugging up an artery in the brain, that's a stroke. Plugging up little tiny arteries in the brain and contributing to neurovascular uncoupling, all of that leading to cognitive impairment and dementia. Okay, that's why people check out of enjoying their life. So if you focus on preventing those things, you'll be much better off. And for example, you talk about cancer. The main thing causing cancer is the Warburg effect of tissue hypoxia due to the same things here that are related to atherosclerosis, diabetes, and hypertension. So, and they all relate to most of these other diseases you've heard of, like congestive heart failure, atrial fibrillation, kidney failure. So that's why it's so powerful to learn how to prevent that stuff, and why we talk about it all the time. Get your exercise, don't smoke, don't drink alcohol. Alcohol's for chumps. It's neurotoxic. It worsens obstructive sleep apnea, makes your brain cells more hypoxic at night, potentially, in that context. And avoid these food toxins. That's why I avoid processed food, too. The MSG is in almost all the processed food. It's actually in a lot of organic foods, too. And then avoid chemicals to the extent you can. I'm a real minimalist. I avoid chemicals as much as I can. Almost all of them, you don't need them. Like, for example, if you don't cook with oil, then you don't need to use dishwasher detergent, I don't put any laundry detergent on my clothes because I don't need it, and it'll tend to be full of estrogenic chemicals. Let's see. Talked about lowering your ferritin level. Avoiding EMF, that's a big new topic. I've given lectures about that on the past, and it's an even bigger topic than what I've covered, but just avoid it as best you can for now. If you want, you can see my lectures on it, and you can search and learn more about that. And the newer stuff like the 5G is much worse because it's pulsed rather than continuous, and that causes a more increased amount of calcium to enter the cell cytoplasm. Okay, let's see. Cognitive decline, a bunch of other risk factors, traumatic brain injury, lack of sleep, lack of reading, sedentary, too much TV. So you can avoid all those things. Stroke rehab should be, for life, really, for years, not just 3 months. Talked about all that, like with the Stroke of Insight video by Jill Bolt Taylor. Notre Dame nun study. So yeah, you can rewire your brain to some extent, form new neurons, new synapses, synaptogenesis. Neurogenesis. The Notre Dame nun study was in Mankato, Minnesota, where these 678 nuns donated their brains to science. And what they found was they're a real good population to study because they're pretty uniform. They don't drink alcohol, they don't do drugs, they don't have OB-GYN variables. So with a relatively uniform group, you can look for other subtle findings. And what they found was the more literary, intellectual, and academic they were, the less likely they were to develop Alzheimer's. And this is called the cognitive reserve theory, the idea that they have more intellectually active brain cells. So even though they'll have a lot of so-called Alzheimer's type findings at autopsy of neurofibrillary tangles, intracellular, and senile plaques extracellular, they didn't tend to have Alzheimer's. They were mentally with it at the time they died, mentally sharp. But it sounds to me like this is to a large extent too trying to save the beta amyloid theory of Alzheimer's. Okay, the bottom line is they're trying to explain why does their autopsy not match their clinical findings, because Alzheimer's is bogus. Okay, avoid aluminum. Aluminum is a major neurotoxin. Okay, I won't let my food be put in aluminum. If it is, I won't eat it. Don't, sometimes you go to a buffet and all the food's in aluminum containers. That's not good. Cheese can contain aluminum to stiff it. I won't never eat cheese. First of all, it's an animal food. It's dairy, but also it'll contain aluminum sometimes to stiffen it, make it easier to cut. Lip gloss can contain aluminum. Isn't that stupid? And you'll be ingesting that. Aerosol sprays will sometimes contain aluminum, especially like deodorant, and then you can inhale that. It goes through your olfactory nerve to your brain. That's especially bad. That stuff sprayed in the sky, the trails of chem. You know what? You don't want to be inhaling that if you can. So, push the button to keep it in circulation in your car. Avoid it to the extent you can. Tea, I think, is overrated. I've talked about that before. You don't absorb all the aluminum, but it can also concentrate. Fluoride, I think they're pretty overrated. The caffeine is overrated. I recommend avoiding caffeine. I don't take multivitamins. They often have things in there you don't want. You want to avoid, be careful about excess copper. It can do some things quite similar to the iron, be an oxidant. So you don't want copper pipes. Let's see what else here. All right, well, that's all for this chapter. I hope some of that was useful to you.